Hello, everyone. Good morning, good evening. Those of you who are living in Ethiopia, I think it's night time right now, so early evening. So, good evening, everybody. Thank you for coming and joining our discussion with my August respected guest, Dr. Miriam Parker. So, today we'll have a very important discussion on a very important aspect of your US residency application. We'll be focusing on the things which you should really focus on during your interview process. Your interview process is the most important one, actually the most crucial one. Up to this time, you have done a lot of efforts, you have done a lot of things, and you have managed to get an invitation from different residency programs. So these opportunities should be utilized in the best way possible. So in our today's discussion, we'll be focusing on what are the most important things during the interview process, what are the things we should be focusing on, and things like that. As you know, Dr. Parker is very respected physician. She's an internist, a fellow of the American College of Physicians. She has been practicing medicine for so many years, and she has been on leadership, especially she has been a program director for internal medicine residency program at Atlanta Medical Center in Atlanta, Georgia. So her experience is really, really vital because, she has been interviewing candidates like you over the years for so many years, and she knows the ins and outs of the interview process during this application season. So without further ado, I will give the floor to Dr. Parker to introduce herself for those of you who are not familiar with her, but I am sure by now most of you know Dr. Parker. So Dr. Parker, it's a big privilege to have you here with me again. Thank you so much for agreeing to dedicate your valuable time with us to deliver this discussion and to share your experiences. So go ahead and introduce yourself, and we'll straightforward go to the discussion right away to save time. I think you are muted, Dr. Parker. Unmute your...
Yeah. All right. Well, thank you. Thank you for inviting me. It's really a pleasure to be here again. I'm not sure last year whether we actually, I don't know that we really did do a talk last year at all, because we started these later. So I was really glad to have the opportunity to really talk about interviews and to share some of the things that, I tell people who work, who worked one-to-one with me about. It is very true that once you get an interview, you want to put your best foot forward. Getting an interview usually means in general that you've probably beat out 90% of people in terms of others who applied for that position. And you have one of these precious interviews that you're holding. And so, it's a different situation then. You really have to know how to shine during the interview. So that's what I'm here today to kind of give you some pointers that I hope will help each of you to do that to your best. So that's essentially it. I'm in the thick of conducting lots of mock interviews. I did a lot last year, the year before. I've interviewed, thousands of people probably with all the residents I interviewed, and then the other types of interviewing I did for other, positions, for fellowship positions, and for other kind of leadership positions when I worked within my hospital. And so I think I've seen probably every mistake you can make, and I've seen people who interview exceptionally well and have tried to glean things, from the individuals who do it really well and figure out, what it is that really makes a good interview.
Yes, Dr. Parker, I think, most of the time, most of us, we think we are ready for the interviews, and in reality, we're not. Mm-hmm. Because there are many mistakes which we might end up committing during the interview process, and that may cost us actually our future, to be honest with you. So if you do well during the interview process, then it's a sure start for yourself. But if you don't, that means you also, destroy, or you also miss the opportunity to get a spot somewhere. So I think this is a very vital part of the journey, to be honest with you, because I'm talking to the to the viewers. So pay attention and listen to what Parker has to share with us. So the first question to you is, Dr. Parker, what is the importance of mindset in confidence building? Because one of the things most interviews lack is confidence in themselves and in their performance.
Mhm.
So what kind of mindset should an interviewee or a candidate have before joining the interview process?
So, I really do think that there's a couple things that you have to really consider when you go in. It is important that you're confident, and even if if you feel like you're shaking and your hands are sweating, at least you have to appear confident, and you have to have developed some confidence in your ability to perform well during the interview. With the practice that you've done. As we've just sort of said, nobody comes to interviews knowing how to do them without practice. And I've interviewed and helped people, coach people who are high level individuals in hospitals, people that are chief medical officers, hold other administrative positions, and when they prepare for interviews, they do the same thing. They get coached, even if they've been doing it for a long time. So it is not something that you're born knowing how to do. It is another skill, just like examining a patient that takes a long time. I wouldn't say that learning how to interview takes as long as it does to learn how to examine a patient, but it's definitely a skill, and it's definitely not something to run away from and to procrastinate in terms of your preparation, because in some way you fear it. So building confidence going into interviews, in my mind, is really about practicing. It's about practicing for the interview. So knowing that you've done everything that you could do to prepare for the interview. It's not only practicing, physically practicing your answers, but mentally rehearsing your answers so that you see yourself as performing in a way where you see yourself delivering in a confident, calm manner and being able to provide clarity to the individual who is interviewing you. I think that one of the key components to it is recognizing that when you've been invited for an interview, they are interested in you. This seems like it should be obvious, but to many people, they look at an interview as a situation where the big opportunity for the program director is to exclude you. And this is not an exclusionary kind of thing. They actually want to find people that they want to put at the top of their list. They're not trying to exclude you. There are very few people actually who will be excluded from a match list. If you can't speak English well enough to do the job, if you have something that is really incompatible with residency in the way that you answer responses, if you're very unprofessional, that could exclude you. And you may not be a great fit for their program, but essentially the majority of people will be ranked on the list. So it's not an exclusionary thing. It's actually that they're trying to include you, keep you on the list, and figure out where they might position you on that list. So seeing the person who is sitting in that seat as your ally, as someone who has actually gone to medical school, applied for residencies themselves, sitting there as a faculty member, and remind yourself, faculty members kind of like residents. That's what we do. We like people. We like to teach. So people who are going to be interviewing you essentially are interested in having you and understand what you're going through. So see them as your ally, not as your adversary in the middle of that interview. And I'll say one thing more about this point, and that is that a lot of times people tell themselves all sorts of stories in the middle of the interview, at the end of the interview, even at the beginning of the interview. If the program director makes a certain face, doesn't respond to them, seems distracted, looks away, any number of things, doesn't respond in a way that makes them feel warm and fuzzy, they take that to mean that the person isn't interested in them. And then the rest of their interview goes south, as we say, because it's sort of destabilized you and you've lost your confidence. So you must ignore essentially any kinds of neutrality that the program director or the interviewer has, anything really positive or negative. I just want you to present your very best self at an interview and not worry about that, because half the time you're really wrong. They could be distracted because they just got a traffic ticket on the way to work. They could be distracted because they just have a sick patient that they just saw, and you have no idea. And if you make it about yourself and the fact that they don't like you, you're just telling yourself stories in the middle of an interview that are not going to be helpful to you.
I think you raised very, very important and valid points. So, like I told you before, maybe for some of the physicians from Ethiopia, if they want to join us and ask questions, I just went live on TikTok. So let me find out if they have been managing to hear your voice. So, hi guys, ይሰማል ቲክታክ ላይ እስካሁን ዶክተር ፓርከር ስታወራው የነበረው ተሰምቷችኋል? አንድ ቁጥር ጻፉልኝ። So today we are discussing about US Residency Application for Ethiopian doctors, and Dr. Parker is a seasoned physician, seasoned and internist by specialty, and she has been on leadership. She has been a program director for more than 25 years in Atlanta, Georgia, at Atlanta Medical Center. So she is here with me today to share her expertise with our Ethiopian doctors who are applying to come to the US to do their residency. So share it with your physician, family, or friends. So if they have a question, they will have an opportunity to ask Dr. Parker at the end of our discussion. So I'm not gonna look at you, those people in TikTok. So keep copy linking and double tapping. And I'll be focusing mainly on the live stream on LinkedIn and YouTube and Facebook. Okay, thank you so much for joining us. So Dr. Parker, you have raised very important points. So don't take things personal. So if the interviewer is somehow distracted, it's not about you. Just focus. Yeah, that's a very important key point. So the second question to you is, unfortunately or fortunately, nowadays, some people might think it's an opportunity, but I see it otherwise. So nowadays, since the COVID pandemic, the interviews are being conducted virtually. So we do not have the opportunity to meet our interviewers in person, unfortunately. I say unfortunately because I like it better than the virtual experience. So tell us about the setup. What shall we do? What are the things we should know in terms of preparing ourselves for the virtual interview sessions?
So I think there's a few things to consider. The first thing is that I think you need to find a space that is with a blank wall, something very simple behind you. I always tell people, don't do what I have here. I'm not being I am being interviewed right now, but I want something that is really, really blank. I know there are a lot of YouTube videos out there that tell you should have a shelf and a plant and a book and a painting and stuff like that. I mean, they have their own reasons, I suppose, to think that those things are really important and that they're gonna sort of create some conversation. But I really believe that when you're in an interview setting, everything should be on you. You're the focus of that interview. And so I don't really think you need anything in your background, but you don't need anything distracting for sure. So, you need to ensure that you have good lighting. You need to ensure good lighting, first of all, because I want to see your eyes. You're the way that you're going to communicate. And if you can't, if it's really dark, sometimes you can't see people's eyes, and that's a problem. My lighting may not be the best here today, but I need to see your eyes. I need to see, it needs to be bright enough. And I know that sometimes people interview with me and they have like one little bulb, we're burning somewhere, or we have, outages with electricity. So you have to figure out how you're going to circumvent those things so they don't become a problem during your interview. In terms of other things, in terms of setup, I think you just now have to know where to be placed. In your setup. You definitely want to be, right in the center. Don't go to one side or the other side. Some people are, very symmetrical, and so you just want to be in the center of your screen. I don't want you sitting all the way back here because I want to wave at you if you do that, and I don't want you sitting all the way like this, just presenting ahead, or, coming too close to the screen, because it really feels like you're invading my personal space. So even on a virtual interview, you can invade someone's virtual space and they won't like it. You have to be comfortable using this format at this point in time. 5 years ago, people could kind of say, well, I'm not really good at virtual stuff. Now, 2025, you can't. So much is going to be like that. So those are really my rules. The other thing is, I would say, is before you do interviews, most of them are going to be on Thalamus, but some of them are on different platforms occasionally. They use a different platform for their interviewing. Google the platform and look at a YouTube video if you're not familiar with it, so you know what you're to expect when you get on the platform before you start, what it's going to look like, maybe where any controls are going to be, so that you take all these unknowns out of the equation. The more that you know what is going to happen at that interview, the better you're going to be, because you're not going to feel, like you're trying to figure it out as you go. Okay.
So what do you think about, like, virtual backgrounds like the one I am using right now? You see, when I am moving, my picture sometimes gets blurred, right? So you can see something is waving in the background. And
I don't
actually,
like
you don't like it. Yeah. So I think it has to be plain. It has to be, straightforward, very simple. You should be the only one, the focus of attention, right? In the focus of attention, right? So
Yeah.
avoid virtual backgrounds like this ones. They are not good. They may not be liked. They don't like it. So don't try to be fancy. Don't try to look fancy. Okay. So that's an important point.
I'll never forget the guy that I interviewed. I mean, this isn't a mock interview. This was a real interview, and the background was one of these like pictures of Tahiti with the beach, and I wasn't really quite sure what he was trying to tell me, but I was just I think the whole interview I was distracted because I was trying to figure out, who in their right mind would have a background on a beach for for a residency interview. It was definitely memorable, but I remembered him as the guy with the inappropriate background. So that's probably not how you'd want to be remembered. Yeah.
Exactly. I agree with you. And I mean, like you said, this is a mock interview. If it was a real interview, then it could go bad, it could go south, like you said before. So the next question to you is, what are the things program directors are looking from candidates? This is very important because we should know what people are looking from us. I mean, what are the things they are focusing on? What are the things we are supposed to be emphasizing and things like that? So what are those things program directors are really focusing on, looking for in a candidate?
Yeah. So, I mean, I can only speak for myself really, and other people that I've talked to and what's out there in the literature. So there can be some program directors who might not agree with this, but I really think there's one main thing and then probably a couple ancillary things that they're looking for. I think the biggest thing they're looking for is are you likable? Are you someone that they could imagine in their program interacting with you for 3 years, 4 years, 5 years, whatever the duration of the program is? Can they see you interacting with not only them, with other residents? Do they feel like they're going to enjoy your presence there? That's really it. And when you break down likability, which is what we would call it, likability really in the setting of an interview means that you appear genuine, that you really are someone who seems like I can converse with. You're authentic. You're not a robot. You're not a robot reading a script. You're an actual person. So I joke about it a lot, but I don't want to meet an AI, robot during an interview. I want to meet a real person. So I want a sense of that you're genuine when you tell stories, when you talk to me. I want to feel positivity from you. I don't want anybody to go in any kind of negative direction about people or places or things, because negativity in people really feels like they're going to be a great drain on the program. So I look for that and make sure that individuals are positive and sort of their outlook about things. And, positivity also ties in with gratitude and optimism and these sorts of things. So those types of qualities. I think we look for individuals who are enthusiastic and have in an interview setting and have some level of energy that they bring to the interview, but not too much energy to the interview. I mean, I don't want you all over the place. I want you to be reserved to some extent, professional in the way that you present yourself, serious, because this is a serious thing, but it doesn't mean that there can't be some moments of levity and some enjoyment in the course of the interview, because, this is life. Everything that you say in an interview doesn't have to be totally serious, but there needs to be some level of energy, and it needs to be appropriate. And what I often tell people is you often should really be checking out the individual who is interviewing you and seeing what kind of energy they bring. Because if they tend to be subdued, it's probably not going to go over really well if you're too excitable. You sort of have to find a way that you don't differentiate yourself too much from where they are, because then it feels like there isn't synchrony, and they're looking in a way for synchrony. Engagement. I need to know that when I'm talking or when you're talking, that we have a conversation. It's like I tell people, when two people are normally talking, one person speaks, the other one smiles, nods their heads. In fact, if you're sitting in a restaurant, you might lean into each other. And as people, you can watch when people are having a really pleasant conversation, because there does start to be this synchrony. And you have to, in ways, sort of recreate that virtually. And then the last thing I would say about interviews and likability is they want to know that you respect them, and that you respect the process. And the ways that you can disrespect the process are interrupting your virtual interviewer, getting too exuberant so you're ready to answer the question and you don't give them time to finish talking, and so you start talking on top of each other as if you have to buzz into a game show early, because you're very much, you're excited about giving them the answer, and you need to guard against that. And the best way to guard against that is just to pause, to take a pause after they've asked you a question, and make sure you're not going to intrude. Also, pausing is kind of a good thing, because it oftentimes makes us feel more thoughtful, and it probably makes us more thoughtful if we take a second before we, blurt out whatever it is that's on our mind. And the other way that you can sort of think about respectfulness is that these interviews are short, guys. I mean, 15, 20 minutes typically. And so the program director or whoever's interviewing you probably has an agenda. I mean, some of these interviews are true. They're sort of free form, flowing, just conversational. But in general, people have some kind of questions. They have some agenda. And if you talk for a really long time about a topic or two, you're actually taking the driver's wheel away from the person who's interviewing. And you are sort of dictating how time is going to be apportioned. And they may never get to the end of their list of things that they'd really like to ask you. And so in doing so, out of maybe anxiety, unawareness, just not really being present and understanding how much time you're taking on a given topic, you, I think, do yourself harm, because you don't allow the person who should be in the driver's seat to lead that discussion. So I think that's a problem for people.
Yeah, those are very important points, like you said it. I mean, you have to be really mindful and don't really start firing before the interviewer has finished asking you questions, right? And most of the time most of us do those kind of mistakes. We start talking without even properly thinking and organizing our mind. Sometimes you have to think, organize your thoughts, and start, responding to those questions. And those skills are very important, and it comes with practice. Not everybody does have that experience. And the other one is, probably, your dog was making some barking noises in the background. So
sorry.
No. I'm just trying to highlight, I want to use that opportunity. So be mindful of background noises. If you have small children, so in the other room, if your kid is crying, that doesn't look good. You know what I mean? Or if there are other people in the next room and maybe making the TV loud and things like that, those things are distracting. And those things are not really good. So if you do not have the proper setup, probably go somewhere. Go to a friend's house, maybe even rent a hotel room for one day. I mean, it's a big investment, I know, but if you don't have the right setup at home, I think you need to think ahead of time and avoid all those kinds of, possible distractions from the background. My next question is, Dr. Parker. So, we growing up in medical school, so when you have like these practical questions and answers, be it an exam or an interview session, we always want the interviews to end, right? So we pray, oh my god, let this question be the last question which I'm gonna face, and things like that. We panic, we want to finish it and go. So shall a candidate see questions this way, or shall a candidate see each and every question as an opportunity to display or to express who they are?
Mm-hmm.
How do we deal with this question? Shall we consider questions as threats and we try to avoid them, or shall we use each and every question as an opportunity to forward some important information about ourselves?
Well, of course, the answer is the latter. You should, of course, see the interview as an opportunity to talk about things that are important to you, things that show your strengths. And in a good interview, I think people would actually like it to go on more than 15 minutes because they feel sort of empowered by the process of the interview and able to really present themselves. Let me tell you, this year, I was really thinking about this whole process and trying to figure out, how can I explain this in a way that really maybe resonates with more people? And this is what I've been telling people. So if you've coached with me, you'll have already heard this, but I'm sharing it with everybody here today. So I tell people, when I'm the interviewer, and I'm in control of the questions until the very end when I give you a few questions that you can ask me, but I'm in control of the questions. And so I give you a question. And when I think about that, I think about it as if I'm giving you a cardboard box, like a plain cardboard box, little box. And I'm asking you the question, and you have the opportunity to fill that box with your answer. So, I may ask a question and somebody puts some things in the box. They just kind of throw some things in the box and then they stop talking. And the only way that I know they're finished answering the question, and this happens all the time in mock interviews, the only way I know they're finished is they stop talking. So I take my box back and I look at it and I think, wonder what that means. But we go on to the next question. Other people, I hand them the box and they answer the question with some thoughtfulness. They put some things in the box that are sort of thoughtfully arranged, and they give me back the box. They stop talking, they give me back the box, and I look at it and I think, there's some nice things in this box. They've kind of worked on how they were going to arrange them in the box, but I'm still not really sure what it means. What are they trying to say to me with these thoughtful things? I have an idea, but I'm not really sure. Other people, you give them the box, they give this thoughtful answer, and then they close the box and they wrap it a little bit. They tell me, for instance, how this might have changed their perspective, or what they learned, or how these qualities they believe are going to serve them particularly well in residency. Something. And it's as if they are giving me a gift about themselves with each question. So I say to you, if you're going to give someone a gift, do you just throw it in a paper bag? I tell my guys that I work with, I said, have you ever tried to give your girlfriend or your wife a gift and you just threw it in a paper bag? I said, I bet that didn't go over big. You do that once and you never do it again. Because, somebody wants, men don't usually care that much about if the gift is in a paper bag or not, but women, boy, they care, right? They care. They want it wrapped. They want it to be a gift from someone, from their partner or whatever, their boyfriend, whomever, their husband. So think of it as a gift. You're giving the program director or the interviewee a gift about you. I think that's a nice way. And you're not giving them many gifts with each question. You're giving them a gift, something that you're emphasizing about yourself. So every question doesn't have to, it can be a lovely answer, and then it doesn't have to end with, and in addition to that, I'm a good team player, I'm resilient, and I believe in patient-centered care. These kinds of answers. I'm like, what? Just concentrate on one beautiful aspect of what you do, what you've learned, and have that be it. Those are very memorable questions and answers. Every time you give a gift like that to someone, it elevates your application. It pushes your application and your candidacy higher on the list.
So these are all very important, things which you have highlighted, and I am sure, our attendees are paying attention. So my next question to you is, during the interview process, the day of the interview. So obviously we are going to introduce ourselves, greet people, and things like that. Not only the interviewer, other candidates will also be present sometimes, right? There could also be a chat room and things like that. So tell us about the process. I mean, and about the interview day, about the entire interview process. How shall we introduce ourselves? How do we, address important questions like, tell me about yourself. Some common ways of opening things, like opening questions for the interview and things like that. Things which you think should be highlighted on those aspects on the interview day.
So, I think that your courtesy, your the way that you behave amongst others is important and is noted. So certainly introducing yourself to the program director or whomever's interviewing you, but also if you are in a group setting, you're asked, you want to be able to introduce yourself, tell them your name, maybe where you're from. Sometimes they ask something very brief about you, so the group of people who are there, especially if it's a small interview group, can kind of just get familiar with each other. Usually you have a schedule, you have an agenda, so you will know who you're going to be interviewing with, although not necessarily. You will be put into different rooms typically, but because of the way that things may be structured, you might have an interview and then you might wait out for a period of time and then have another interview. And then maybe in the end, there's something with the group. There's usually a session where they give you a program overview. In the end, there is often time for you to speak with residents in sort of a chat room. So every program will do that slightly differently. Stay close to your computer. Just don't disappear because they may call you back. Know what the times are. And if you have opportunities to interact with people and ask a question, ask a question. Even in the chat rooms where you're with a bunch of other people, some individuals will take note if you were someone who was particularly interested in the program, asked a question that was, that helped other people understand the program a little bit better, etc. So don't be silent, but be mindful that there are other people there too, and they have their questions. And so if you ask one question, you defer to the rest of the group, so everybody has equal opportunity. When you are in the interview, typically the interviewer will, of course, introduce themselves first, and then it's your job to introduce yourself. And so you may say something like, it's good after they've introduced themselves, you say your name and you say, it's really good to be here. I'm very excited about the opportunity to meet you today. I'm excited about this conversation. I'm honored to be here to interview at your program. But you don't have to go on and on. Some people just go on and on and on, and it's too much. They know that you're gunning for that position. They know that you're there to do a good job, but you can't just say, good morning. You can't do that, but you can't run on too much either. The other thing I see people making a mistake is once I introduce myself and then you say, good morning and thanks for inviting me, that is not the time when you then launch into your tell me about yourself. You are then asked, you should stop. And then the program director, whomever, will say, I've read your application, but I'd love to hear from you. Can you tell me a little bit about yourself? But you need to be asked to do that. Many people just assume that once the program director has introduced themselves, that it's time to launch into that story, and it's not yet the time to do that. That's just understanding protocol, and those things are important because it does show your understanding in a professional way of how to manage an interview. It's not a big deal if you make that mistake, but it is, I would say it's a minor little, mistake that one makes in interviews.
Those are really valuable inputs, Dr. Parker. Thank you so much. For those of you who just joined us late, so I am live on TikTok, Facebook, YouTube, and LinkedIn. So I have invited very respected physician internist, Dr. Parker, who is currently in Georgia. She has been in leadership as an internal medicine program director for almost more than 25 years. She has a very extensive knowledge about US residency application and interviewing and all that, the entire process. For the past 2 years, or almost 3 years, she has been coaching different applicants from all over the world. She has helped a lot of our fellow physicians to successfully match into US residency positions as well as fellowship positions. So that is the reason why I invite Dr. Parker to spend her valuable time with us. And I'm really grateful again for you coming here and spending your time with us. So I will give an opportunity for some of you guys to ask questions directly if you can join on TikTok, because I'm also live on TikTok. So you can come on TikTok and you can join me as a guest, and you can forward the questions, or if you simply type your questions either in YouTube, Facebook, or LinkedIn, I will display it, and also Dr. Parker will address them. Okay, we have a couple of other questions to go through. As soon as we finish, we start accepting your questions. Thank you so much for joining, everybody. So the other thing is, Dr. Parker, the majority of the time, even during my interview season, I remember people would tell you that, the program director will ask you about your strengths, about your weaknesses, and how you would contribute to that program and things like that. And most of the time, we always struggle to answer these questions, right? What are my strengths? Am I bragging by telling them my strengths is, or which things shall I present as my weakness? Can that weakness may backfire against me? These kind of things will put most people in dilemma. So if you can address those kind of questions, I would really appreciate it. Go ahead.
Okay, I can do that. I thought maybe if I could just start in sort of chronological order and say a few things about the tell me about yourself first, because I do think that actually is a good starting point, because I think you sort of end up demonstrating a little bit about your strengths in that part. So it's sort of a place where you start hinting about certain things. I see a lot of people struggle with that tell me about yourself, and I totally understand why. It's really hard. It is hard, and people have a lot of misconceptions about how to do it. I don't think there is one right way to do it. Some people feel like they come and they give me some disorganized thing, or they tell me some story that really is just one long story that doesn't really relate to why they're even there at the interview potentially, but they have this notion that they're not supposed to talk about their resume in their tell me about yourself part. I'll tell you how I think it's most effective. You only have about 2 minutes for tell me about yourself. And if you imagine the person who's the interviewer having to interview you after they've just interviewed 5 other people that day, and they vaguely remember your application. They've looked at your application, one starts to seem just like the next after a while. And I don't mean that in any negative way, but it is true. Many of the applications have much of the same flavor. And so one of the things that you can do to help them when you get your tell me about the question is sort of walk them through a little bit. It's sort of like walking them through your life, walking them through medical school. If you've done residency, what you're doing as a medical practitioner, if you're currently working as a GP or doing something else. And then along the way, highlighting certain things that you might have been involved in. Let's say you did an amazing volunteer work where you had a leadership opportunity. You can plug that in to your tell me about yourself. If you've done interesting research, if you've done, whatever it is that you've done that you think is really interesting that you would like them to ask you about later on, it's something that you feel like is a real strength of yours, put it in the tell me about yourself. Plug it in as one sentence because to me, what I call that is dropping breadcrumbs. It's like you're dropping breadcrumbs for the birds to pick up. You're dropping breadcrumbs and hope that your program director, the interviewer, is going to feel like, oh, tell me about that. And it's something that should make you shine. It should be something that is really easy for you to talk about, and that you've highlighted it. So you basically are inviting them to ask you about those things. They may not ask you about those things, and that's okay. But you've at least, given them the invitation to ask you about them important things, because they might just look at your application and pick something else out of it and say, tell me about that. And you may not feel that particular, rotation, that particular experience is as important as the one that you could have, as the one that you had suggested. So suggest things like that on your tell me about yourself. That's probably one of my best tricks, in a sense, about that. And have some closure at the end to tell me about yourself. Don't just kind of end and, and so I play soccer and, well, that's it. I mean, something that closes it, at the end about your, being excited to further discuss your candidacy, or to see if you're a good fit, or you hope that that by the end of the interview, they will, see you as someone who's a very collaborative and empathic person, or something. Maybe I hope to have you understand my commitment to service. I mean, something at the end that is sort of, again, it's packaging this tell me about yourself into a nice package for them. Don't just stop talking and, well, that's it. I get that. It's not. I'm laughing here, but I tell you, I do appreciate how hard a task it is to do this. The other thing is, please recognize that in all of the things that you do, I tell people this. Let me just digress for a second. If I have to tell my story, and I started out in Philadelphia. That's where I was born. I went up to New York City and went to college up at Columbia in New York City, and then I stayed at NYU for a while doing research. I then came back to Philadelphia and went to medical school at Temple, and then I came down to Atlanta and did my residency here and worked as a program director, all that stuff that followed. Okay, these are all stops along I-95, the major route. Okay, so when I think about telling my story, I don't need to write a speech out. I know where I traveled on the map. I just have to figure out which points I'm going to go to. And I'm going to stick with those. So whatever stories you decide you're going to tell for your interview, you do not need to write a speech out. And I would definitely tell you not to do that. But know the points on the map that you're going to stop. It's like bullet points. Know the bullet points you're going to stop. And don't decide that if I'm going to take Interstate 95, that all of a sudden when I get to, Virginia, I'm going to take some side route and I'm going to end up, in the mountains somewhere in the middle of this conversation because somehow I got distracted and I found myself talking about something else that wasn't part of what I intended to do. You must be focused and you must know the bullet points, and then you hit those bullet points, and you will have said it so many times in practice that it will feel natural to you, but it won't sound like you've memorized something. You will be able to talk about it with fluency and with a sense of genuineness, instead of me feeling like you're reading me a script. This is not a script. We're not at a speech. We're at an interview. They're really, really different things.
I think that's very important. It has to be natural, right? This is your life journey and you should know it by heart. You don't need any reference, right? It is in your head. It's in your head, so.
Exactly. I tell people, if you don't know your life's journey, then no one can help you with that.
That's very true. And I think deciding on which ones to highlight is the one which matters the most, and have a flow, and a beautiful natural flow. And it shouldn't seem that it is studied, choreographed. It has to appear and it has to be natural to the best of your abilities. That's very important. So just for the interest of time, Dr. Parker, probably I'll ask you one or
Yeah,
to
yeah.
questions. We can simply answer them, then we can address questions which are coming from the audience. So one of the things is that, like, like I said, what are those some people in some programs may face some behavioral health questions, and some people panic about those questions. They think they are traps. Are they really traps or opportunities? So how do they deal with those kind of challenges? And the last one is that probably each program will give you an opportunity to ask them questions, right? What question do you have for me? So everybody would say at the end of the day, that means they are concluding the conversation. So when we are given that opportunity, shall we simply say, "Oh, thank you, I don't have any question"? Shall we say that? Or what kind of, if we don't have to say that, what kind of questions should we pose, our interviewers? And that will be my final question. Then, at the end of the day, we'll be focusing on some of the questions coming from our
Sure.
audiences, and we'll conclude.
Okay, so let me address the behavioral questions. Yes, most people think that the behavioral questions are, quote, out to get you, out to get you. They're not out to get you. They're really not. I think they're very misunderstood. I tell people about the behavioral questions that they really shouldn't be difficult. The behavioral questions shouldn't be difficult once you try to understand why they asked that behavioral question. Why would they ask that behavioral question? Are they just trying to trap you, or are they trying to find out something about you? Why do they ask you about your mistakes? Why do they want to hear about a mistake that you made? And they don't want to hear about some trivial mistake that had no relevance and doesn't have any meaning, because they want to see, first of all, they want to see your honesty, because everybody makes mistakes. Secondly, they would like to see that once you've made a mistake, what do you do about it? How did you react to that? If it was in patient care, did you immediately notify someone about your mistake so that you could figure out what you were supposed to do at that point? Did you own up to your mistake? Are you someone who is not going to push the mistakes under the rug and try to hope that nobody notices them? Are you someone who is going to apologize if there's a mistake? In the right situation, when apologies or disclosure is appropriate? Are you going to learn from it and maybe teach other people about your mistake so they don't make the same mistake too? Those are the kinds of people that you want in your residency program, because everybody's going to make mistakes, and you want the individuals who are going to recognize their mistakes, or when they're pointed out, they're going to accept responsibility for their mistakes. They're going to learn from them. They're going to disclose. They're going to do all those things. So these questions, if you understand the intent behind them, and I think that any of you, when you ask yourself, why would they ask me this question, should be able to figure out what the intent behind the question is. And if you figure out the intent, then I think you really know how to answer that question. They shouldn't be mysteries. And they're really opportunities to demonstrate your knowledge of how to take care of patients, your ability to navigate things with individuals, whether it's in medicine or outside of medicine, your ability to work with other people in teams. These are all very instructive questions, and there's a reason that people ask these questions. Yet a lot of times the problem is that people give answers that are so trivial that they're not non-starters, and you feel like that the individual is just trying to protect themselves and not say anything that they feel could harm them. So when they say, what's a mistake that you've made, somebody says to me, well, when I first was a medical student and I had to put, my first IV, I missed the vein and I caused the patient pain, and that was a horrible mistake. And and you look at them like, really? That's what everybody experienced the first time and the second time and the third time and the 10th time they try to put in an IV. I mean, that is not a mistake. That is, that's just normal experience. And you need to do better than that. You need to search a little deeper than finding something that's very superficial, because it won't help you. The program director will probably realize, yeah, they're just not wanting to tell me something that they did. And so you don't get any credit for those responses. And in fact, if you tell me those sorts of things, if you tell me, if as a medical student, you're just like a PG, you're just graduated medical school and you tell me something like that, okay, maybe I can handle it. But if you tell me after you've been practicing for 5 years that the biggest mistake you ever made is something like that, I know you're not telling me the truth. I feel like it was a very poor choice not to tell me something more. And I think I downgrade you because I don't believe you. And so then I'm wondering, if you do make a mistake, are you going to tell me about that mistake? So it doesn't have to be your worst mistake, but it can't be the smallest little mistake that you've ever made either.
It
And
has to be something major, right? It has to be something major. And then you should reflect your honesty. We are all vulnerable, right? As a human being, we do make mistakes, different mistakes, knowingly or unknowingly. So I think we should reflect on that vulnerability with honesty. What matters is your honesty and how you handled it, right?
yeah, I mean, I've been telling people a story lately that actually one of the surgeons told me. He had been a practicing surgeon, and he told me a mistake that he made when he was just out of his surgical residency, had sort of his first job. And this was probably a mistake that some people would never have thought to tell people. But I find, and I'm not just saying this because you're a surgeon, but I find that the surgeons are usually, not always, but they're better at disclosing their mistakes on an interview, probably because you had to face M&M so many times, than people who don't. And they are aware of that, that people make serious mistakes, and that it's not pleasant to sit in the hot seat and get grilled and get humiliated maybe, but in the end, you don't make that mistake again. And the people that were sitting there probably aren't going to make that same mistake either. So the surgeons are usually, to be honest with all you guys, because I'm probably dealing with a lot of medicine doctors here, but the surgeons are usually a whole lot better at answering these questions because they recognize that mistakes happen. The medicine people are usually the ones that want to cover up everything for me.
Yeah, because maybe somebody else may come and cover their, their mace, whatever mistake they have done. But as a surgeon, you are right, because whatever mistake you make, it might even cost the life of your patient. If you make the wrong decision, if you delay procedure and the patient gets complicated, or you did the wrong procedure and the patient didn't benefit, or you didn't really perform your procedures well and there is a consequence, there is a lot for the surgeons, and they really embrace it, and they have to be open and communicate with the patient because the outcome is going to be seen, right? It's going to be measured. I have done a certain thing, it's irreversible, so they have to be honest, actually, right? So even when you are facing your patients, honesty would save you from a lot of lawsuits, right? So if you try to hide it, you irritate me as a patient and I come after you. But if you have been honest, you come to me and you communicate with me whatever has happened while I was under anesthesia, I will forgive you, right? Because I would think you are honest with me and I appreciate that. So I think these things are really important. We face them every time. And thank you so much, Dr. Parker, for your invaluable insights. We do have a couple of questions which are forwarded from the chat. One of them says, Dr. Johannes Kirma, I think he's from Ethiopia. Thank you, Dr. Parker, for being helpful. Can you give us your opinion for people who have already completed home country residency and applying for the same specialty? Do you have any advice on how we should present ourselves? And thanks. Actually, this is simple and straightforward. We don't have to brag a lot. Dr. Parker will say something more. But the question becomes more complex if you are changing a specialty, just like I did, from internal medicine to surgery, or from surgery to internal medicine, or other special radiology to internal medicine, vice versa. So you can say something about this kind of things because it's a common question, Dr. Parker.
Well, I guess the first thing that I would say is that that you want to disclose that you've been a resident, and you want to be proud of having done that resident in your home residency in your home country, and recognize that you actually have learned a great deal from it and have a lot of experience from it. At the same time, having done a residency in Ethiopia or in other countries where the patient population is different, the disease prevalences are different, the resources are different. I think you have to acknowledge the fact that the reason that you're coming to this country to train, obviously, are, because of the resource limitations, and because although you've done a residency already in your own country, you absolutely need to do a residency in this country to be able to practice medicine. I can honestly tell you that I've never seen someone who came from any country who would have been able to step in, practice medicine in this country without going through at least 2 years of a 3-year residency. They probably could have been fast tracked, honestly, some of them, but not all of them. But there was just so much to learn. So I think that people who have already done residencies, if they can present themselves as someone who, yes, has experience, but doesn't have any experience in the United States, and is someone who really is attached to learning, and that they recognize that when you begin, you don't begin again, but you build on what you've already learned when you do a second residency in the same specialty, and you fill in all the gaps. You start not only learning what it's like to practice in the United States, but you fill in the gaps. Topics that you really maybe didn't spend a lot of time on in your first residency, you concentrate on them in your second residency, and it gives you the opportunity to grow and to become an outstanding internal medicine clinician. So that's how I would utilize that opportunity. Don't try to pretend that you're not experienced. You are, and you've learned skills not only of medicine, but of professionalism and those things that go along with it. But you have to say, I've never practiced in the United States, and it's very, very different. And so I absolutely believe that I need to do this residency here. I need to have supervision while I do this residency, graded autonomy, and I'm looking forward to filling in the gaps and to, end up becoming, after 3 years, a better internist that I am today. I don't see how anybody can fault you for that answer.
I think this is beautifully answered, actually. So I remain humble and highlight your achievements. Those are the two most important things. Don't be arrogant, and don't present yourself as if, like, you are done learning. That's a big no and red flag. So make sure that you convince them that you are ready to learn new things. And of course, practicing in the US is completely different from practicing in Ethiopia, even in Europe or elsewhere, because I had the opportunity to practice in India, in the Scandinavian, in Sweden. So the US healthcare system and the way it is run is completely different. So you should be humble and convince people that you are ready to learn new things. So Dagam Bala is another candidate, I believe. So thank you, Dr. Parker and Fatada, for this webinar. Is it okay to prepare the same question for the program director and faculty physicians? Like, when they say, I think, when they give us the opportunity to ask questions, can we pose the same questions, or do we have to ask them different questions?
I guess the answer would be, it depends. It depends on what your question is. If you're asking things that are specifically about curricular things, then probably the other faculty may not be able to answer those questions for you as well as the program director. If you ask questions like you want to understand how, feedback from the residents is incorporated into programmatic decisions, then probably the faculty members are not the people to ask that question to. Associate program director, and stuff. So remember who your audience is. But if you're asking questions like, tell me about what kinds of things you love about this program, what do you think are the highlights here, then you can ask that to the program director. You can ask that to anybody. There are questions that could go across all, from program director down to chief resident and residents that you could ask. I do think you don't want to use up questions that can be asked of the residents or the chief residents and ask those questions to the program director. I think you really want to use broader questions that you ask to the program director. And I would say one of the things that I've always thought about is, when you really do ask a question to anybody, ask yourself why you're even asking that question. Is it just to ask a damn question? Or is it actually because you believe that the information that you could get from the answer to that question might actually inform whether or not you want to go to that residency program or not? What I see a lot in people is we go through the whole interview, and then at the end, I haven't heard one thing about fellowship or that they want to do research. And at the very end, when it gets to the question, they say, I'm very interested in research. I want to know about the research possibilities here. And I say, that isn't consistent with anything you've told me. The whole application, I feel like you're asking that question to me because you just think somehow that I would maybe think more of you if you asked me at this point about research. You can tell there are people who have done research, who want to do research. It's evident from their application. And so maybe at the end they do ask the question about what research is available to them. But that's very different from someone who tells me that they're interested in primary care, and then at the end they just throw that in because I don't understand why. It feels like it's incongruous with the rest of their application and their interview. So ask the question only if you're really interested in the answer and you think that it actually is consistent with things that you want to know to help you make a decision about residency. And for God's sakes, don't ask them personal questions to the program director. Tell me about some obstacle you face. Really? Don't ask those questions to the program director. It's really inappropriate. And I've heard people that want to ask those questions. I said, you can save that. Maybe once you become a resident in the program and you get to know the program director a little bit, maybe you could ask that question. But don't ask them personal questions.
At least once you secure your residency position, there is nothing they can do to you. But now, it's going to be bigger. You coming to my program, my dear. So that's really important. You should be careful and don't ask questions for just the sake of asking questions, right? That is the bottom line. So don't ask questions just for the sake of asking questions. So think about things which you want to know. So Emmanuel Abesha, he has asked a question, but I don't think...
I have no idea.
We have no idea. One of the things I would advise you is if you have a family living in the US, they can call ECFMG and ask the questions you are posing. You know what I mean? So I have no idea. Or just go on the website for ECFMG and find out how that plays out. I have no idea. Things have changed a lot over the years. So I have no clue. And Dr. Parker, the same thing. So Bethlehem Gedawark is also, I think, is a young physician. She's asking, it's off topic, actually. I don't know if we have to answer it or not. She is asking your advice about what is your advice for someone torn between postponing a matching cycle to focus on building a good era CV, like research volunteering, and risking being an old graduate 3 years? Come on, what do you mean? Don't harass me. I applied after 12 years of graduate.
Okay, listen. Step 2 scores. I would tell you, concentrate on step 2 scores as one of, I'm telling you, as one of the most important things that I can tell you. I've said this repeatedly. It has become an incredibly important thing to do, and building your application is important to do. Don't worry if you're 3 or 4 or 5 years down the line. It will not, not having a good score will be far more detrimental than waiting an extra year. I've told people this many times over.
All right. Thank you, Dr. Parker. I really appreciate it. There is one last question here from Jonas Abebao. Thank you, Dr. Parker Fakadasalasi. What do you think about sending thank you emails after the interview? So if anybody from Ethiopian physicians applying for US residency, if you are on TikTok and you want to come on board and ask questions to Dr. Parker, just write one and send a guest request at the same time, and I will try to pull you. We do have only 5 minutes, I guess, and we'll conclude our conversation soon. So if there is anybody on TikTok live attending this seminar and wants to ask questions directly, just write one and also send a guest request, and I will invite you to the guest. All right, go ahead, Dr. Parker, probably respond to the last question.
Yeah, I think you should. I think they should be short and they should be personalized. I tell people that when you're doing, right after you've interviewed with someone, have a little notebook for your interviews and write down, talked about, X, Y, Z with that person. Like if there was a specific thing in your conversation with them that was notable, write that down so that you can refer to it in your email to them. So there's some personalization of the email. So yes, I think, some places will tell you they don't want to hear from you and they don't want emails, but I think for the most part, they're totally acceptable, and a lot of people will look at them and say, okay, at least it's sort of like the absence of an email is notable because so many people do it, so that if you don't do it, it seems sort of odd. Like it's almost like the lack of it suggests that maybe you're not interested in the program, rather than doing it indicates some overwhelming interest.
Yeah.
That's sort of my take on it. It's become what everybody does. I don't think if you talk to people, and like when I was in the dark ages, yeah, I mean, you had to actually write a letter and put a stamp on an envelope and send it because we didn't have the internet. I mean, so you had to go to great effort to send a letter. So no, you didn't do that. But now I think everybody does it, so I just would go ahead and do it.
And be careful when you write those letters, because nowadays people are writing letters using AI and Chat GPT.
Oh
So, you have to be careful that you are writing a personalized letter for each and every program, because you have to highlight your experience during the interview time in each thank you letter, so that they would remember you with what was happening during the interview session. Okay. So don't send like an automated letter. It has to be personalized, and it has to reflect your experience during the interview session. So be careful with that. Probably final questions from Mahalit Girma. Hello, thank you. Dr. Parker, for your time. Question. So how important do you think the US clinical experience or observations are when evaluating international applicants? It's out of topic, but if you want to respond, you can. Otherwise, we have dealt with this topic many times, and she can refer to past discussions.
Well, I mean, of course they like to see them, but for most people it's not possible. So there are many people who don't have them and still get interviews. If you can, I see more and more people trying to do some virtual interviews. I mean, virtual rotations now to put something on their application. I think that the things that obviously that IMGs have going against them right now is the fact that they can't get clinical rotations, and that the visa thing is obviously an issue that we don't know how that's going to all play out. And for the most part, you can't really do anything about either one of those things generally. So if you can't do something about it, then I say, don't worry about it and concentrate on the other things that you can do something about, because it's really useless to worry about it if you can't change it. Work on making sure your step scores are good. Making sure that you have valuable volunteer experience or other experiences, leadership, other things. Because it's not just like to put on your application to put on your application. These things actually change you as a person. They really do. I would really encourage people to think, and I know many of you do, but I know that part of it is like, I'm going to build my CV, you're thinking, but it's also about building you as a person, because people who have meaningful volunteer experiences, leadership experiences, they're really meaningful. I think they change you. They change your perspective on things. They make you more interesting. People want to engage with you. You develop you develop confidence in yourself often. You push yourself to do, well, every time we push ourselves to do things that are outside our comfort zone, we always grow from them.
Those are very important things, Dr. Parker. So if you don't have anything, like
I can
in
stay
terms
around
of,
for a couple more minutes.
yeah. So I mean, I think we can conclude here. I would give you the chance to highlight on some other important things you would like to forward as a closing remark. And one of the things I would like to encourage our viewers, especially if you are candidates and you have a couple of interviews, and nowadays, especially for those of you who are overseas, like applying from Ethiopia, getting an opportunity to get into the interviews, invited into the interviews, is becoming really hard. So if you manage to get a couple of interviews, you have to know how to use them properly and end up securing a residency position here in the US. So I would like to tell you and kindly advise you to get a coach, whoever that person might be. I'm not necessarily talking about Dr. Parker, but if you ask my honest opinion, I would encourage you to sign up with Dr. Parker, because, like, I don't know. She just informed me before we started our conversation. She may do me a favor and opening few slots for few early coming candidates to give you an opportunity to sign up with her for mock interviews. These are very important. Very, very important. You may think you are ready, but you are not the majority of the time. So those of you who have the opportunity and who can sign up, please reach out to Dr. Parker. I have kindly asked her, and she has promised to me she will open up some few slots for few candidates, so that you will be able to have mock interviews with her. That's very important. If it is not Dr. Parker, try to find someone who would kind of rehearse with you about, and prepare with you for the interview sessions. If it is a physician, especially who have been practicing in an academic environment, would be better, because not every physician is qualified to advise you on how to handle, like, US residency applications. Even the way we conduct interviews in Ethiopia is completely different from the way interviews are being delivered and conducted in America. So those of you who have been reaching out to me personally via inboxes and all that, here is your opportunity. And I would like to thank Dr. Parker at this moment, because she has agreed to open up few slots for those of you who are really, really looking for someone to guide you. So, Dr. Parker, so here is your time now. Go ahead and tell them how they can sign up with you if they are interested. And if you have some more information or some things which you would like to highlight, you can go ahead and say. And finally, I want you to rate my attire and everything. If I was, like, in a residency or fellowship match interviews with you, would I score high, or I'm in trouble due
You'd
to
be
my
in trouble. No
I
tie, no suit, no jacket. I don't know about the professionalism level here. Too casual.
very casual, yes.
So, that's it's an important point. Look, I think what he was probably trying to really emphasize is that an interview is an opportunity to certainly show a lot about yourself, but it's also a time to be professional, and that's what programs are really looking for. Interesting, engaged applicants that are also professionals. So you have to be mindful of all these things. Everybody can learn how to do interviews. Everybody can improve their interview skills, but it means that you have to face yourself and you have to practice these questions. And ask some people what they think of your answers if you're really not sure. Sometimes I know that can get tricky because different people have different things to say, and it can really confuse you. So choose who you're going to ask to sit with you and do your interviews, because I think sometimes you get so many differences of opinion that it actually is more confusing. It's like showing your personal statement to 20 people, and 20 people have different things to say about it. Remember that, I want you to really remember that those interviews that you get are really precious. And I've seen plenty of people match with one interview and they matched because they did a great job. If you got one interview, then you got one interview. I have seen less interviews being given this year than I saw last year. And I think, related to visa things. So, take what you have as gifts, and give that gift of yourself when you actually have an interview with the program director. Make sure you show your strengths in your answers, because all of you have those things within you. And it's just a matter of figuring out how to bring those things out in a succinct, direct way that really speaks to the question. And, and in doing so, you demonstrate, your authenticity and your fit for that program. So that's really it. They can, you can just go to my website. You can look around, get to know me a little bit better, sign up if you want. You don't have to ask you don't need permission. This is permission. I never pick and choose anybody who wants to sign up. Anybody who wants to, interview with me, as long as I have opportunities, is welcome. And I think all of you who have worked with me know how much I've enjoyed over the years working with the Ethiopian community and seeing success. That's my intention, to help each one of you be successful in this very difficult and arduous journey. So thanks.
What about now, Dr. Parker?
There you go. I think so. Yeah. I'd say you're ready now. You're ready. We just got to get the virtual background out. But other than that, you're ready.
I did it on purpose. When I joined you, I did it on purpose because I would like to emphasize on these things, because it's really important. Don't assume that you can come with your casual shirts and things like that. You have to be professional. You have to make sure that you are respectful to the entire session and you are respecting the opportunity you are given. So be very professional. Ladies, the women doctors, you should also be very professional. You should know how to properly dress for a professional interview. So I did it on purpose, and the reason why I added my tie and my coat at the end is just to emphasize you should be very professional and respectful. That's it. Dr. Parker, I don't have words. I really respect you. I appreciate your expertise. And thank you for dedicating your time. I know that we don't even have time even to text back each other, right? But you dedicated almost 1 hour and 15 minutes with me to share your invaluable expertise, and I'm really, really grateful. Thank you so much for your service. We really appreciate you. We respect you. Okay, that's a feeling of most Ethiopian physicians as well.
Anytime.
All right. Thank you so much. Have a blessed day. I will say a few words about the rest of the sessions in Amharic. There are about 131 people on TikTok as well. So, and I will say a few words in Amharic at the end of the session, so you are excused.
Okay.
And thank you. I'll reach out to you, Dr.
Okay.
Thank you so much. Okay? Have a blessed day. Have a great day. All right. ቅዱሳን ያው እንግዲህ ኮቴን ምናምን ያመጣሁት ደግሞ በጣም ተጠንቀቁ። አሁን ብቆም ምንድን ነው የለበስኩት ይታያችኋል? ይታያል። በፒጃማ ነው የተቀመጥኩት፣ በቤት ልብስ ነው እና you have to be careful። አይታችሁኝ ከሆነ እንደዚህ እየተንፏቀቅኩ ነው ኮት ለማምጣት ማለት ነው። ቢ ኬርፉል። ኢንተርቪው ላይ ብዙ ሰዎች ተዋርደዋል ታውቃላችሁ አይደለ? ዙም በመጣበት ሰዓት በቁንጣ በምንድነው በግልገል ሱሪ ወይ በቁንጣ ምናምን ቤታቸው ቁጭ ብለው ከላይ ግን በደንብ አታየራቸውን አስተካክለው ቁጭ ብለው የሆነ ነገር ድንገት ሲገጥማችሁ ዲስትራክትድ ስትሆኑ ትረሱትና የሆነ ነገር ለማምጣት ብድግ ስትሉ ወይ በቁንጣህ ነው ወይ በፓንትህ ነው ወይ በቢጃማህ ነው ምናምን ማለት ነው። እና እንደዛ አይነት ነገር እንዳይገጥማችሁ ልክ ኢን ፐርሰን ለኢንተርቪው ተጠርታችሁ እንደሄዳችሁ አድርጋችሁ ሙሉ ስፋችሁን ለብሳችሁ ነው ገጭ ፏ በልጭ ብላችሁ ቁጭ ማለት ያለባችሁ። እንግዲህ ወዳጆቼ ቲክታክ ላይ ያላችሁ ምን ጉድ ነው ዶክተር ዛሬ ይዞብን የመጣው ምናምን ካላችሁ ያው እንግዲህ ለኢትዮጵያውያን ሐኪሞች ለጁኒየሮቼ ከኔ ኋላ ላሉ አንዳንዶቹም ሲኒየሮቼም አሁን አፕላይ ያደረጉ ነው ከኔ የሚቀድሙኝም የሆነ ሆኖ ብቻ ከኢትዮጵያ ወደዚህ ወደ አሜሪካ ወይም ከተለያየ የዓለም ክፍል ሆነው ወደ አሜሪካ መጥተው ሬዚደንሲ ሰርተው በዚህ ፕራክቲስ ማድረግ የሚፈልጉ ኢትዮጵያውያን ሐኪሞችን ለማገዝ በሚል የምናደርገው ሴሽን ነው። ከዚህ በፊት ወደ 8 ኢንተርቪው ከዶክተር ፓርከር ጋር አንድ 5 ይሄ 6ኛው ሴሽናችን ይመስለኛል። ከሌሎች ሰዎች ከዶክተር መሳይ ጋር 2 አለ፣ በራሴ ያደረኩት አለ። ብቻ ቶታል ወደ 9 ኢንተርቪው አለ ማለት ነው። እና አሁን ኢትዮጵያውያን ሐኪሞች ካላችሁ መጠየቅ የምትፈልጉ ሰዎች ካላችሁ ሐኪሞች ብቻ ካላችሁ ቲክታክ ላይ ቃል ገብቼላችሁ ስለነበረ ገስት ሪኩዌስት አንዳንድ ቁጥር ሐኪሞች አንዳንድ ቁጥር ጽፋችሁ ያልተመለሰ ጥያቄ ካለ ለመመለስ ሞክራለሁ። እዚህ ዩቲዩብ፣ ፌስቡክ ላይ እና ሊንክድኢን ላይ ያለኝን ሴሽን በዚህ ጨርሳለሁ። ኢንተርቪው ያገኛችሁ ሰዎች ግን በእውነት ነው የምነግራችሁ፣ እኔ ፕሮሞሽን እየሰራሁ አይደለም ለዶክተር ፓርከር። ኢቭን ፕሮሞሽን ብሰራላትም በጣም ነው ደስ የሚለኝ በእውነት ቢካዝ እንደምትጠቀሙበት እርግጠኛ ስለሆንኩ ነው። ኮስቱ ፋክተር ካልሆነ አፎርድ የምታደርጉ ከሆነ ከሌላ ፍላጎታችሁ ቀንሳችሁም ቢሆን የ1 ሰዓት የ2 ሰዓት ሴሽን ከሷ ጋር ለሞክ ኢንተርቪው ገዝታችሁ ሴሽኑን ፕራክቲስ ብታደርጉ በጣም ጌም ቼንጀር ነው በእውነት። ቢሊቭ ሚ ጋይስ፣ እኔ ያው እህቶቼ ወንድሞቼ ናቸው። እኔ ምንም ኢንተረስት የለኝም፣ ቢዝነስ ፓርትነርሺፕም የለን ምን የለን። እኔ ጀስት አውት ኦፍ ጉድ ዊል እና ጉድ ሀርት ነው ከኔ ኋላ የሚመጡ ሐኪሞች ቢጠቀሙበት በሚል ይህን ኢንፎርሜሽን እያስተካከልኩ ወደ እናንተ ይዤ የሚመጣው ማለት ነው። እና እውነት ለመናገር ብዙ ልጆች በውስጥ እኮ ለምናችሁኛል፣ ዶክተር ዋሻው እስቲ እዚህ ካላችሁ ተናገሩ፣ መስክር ሁኑልኝ። ዶክተር ፓርከርን አገናኘኝ አላላችሁም? ገና ሴፕቴምበር ሳይገባ ነው ኦገስት መጨረሻ ላይ ሶልድ አውት ብላ የላከችልኝ። ምክንያቱም ላስት ይር ለብዙ ሰው አስቸግሪያ ስለነበር ከተዘጋ በኋላ ያው እኛ ኢትዮጵያውያን እንደምንታወቀው እስከ ላስት ሚኒት ጠብቀን ነው የምንመጣው። ጉዳዩ ካለቀ ከተዘጋ ምናምን በኋላ ነው ስክራምብል የምናደርገው እና ላስት ይር በጣም ለብዙ ሰው አስቸግሪያ ስለነበር እዚህ ሲር ገና ኦገስት ላይ ፈቃድ እንዳትረብሸኝ ይመስለኛል በቃ ሶልድ አውት የሚል ገና ኦገስት መጨረሻ ላይ ነው የላከችልኝ እና ምንም ቦታ ስፔስ መተናፈሻ የላትም። እግዚአብሔር በሚያውቀው ቀድሚያት ገብቼ 5 ሚኒትስ ምናምን ሲቀር ነው ጆይን ያደረገች። ለቴክስት እንኳን ጊዜ የለም። እዚህ ሲሪየስ ናት። በጣም ፕሮፌሽናል ሰው ናት። በጣም ታግዛችኋለች። በጣም ደግ ሰው ናት። ደግሞ በጣም ደግ ሰው ናት። አባቭ ኤቭሪቲንግ በጣም ለገንዘብም አይደለም የምትሰራው። ይሄንን አይ ሚን ምን ያህል ከፍላችኋት ምን ያህል ሊጠቅማት ነው። ሞክ ኢንተርቪው ናላ ነው የሚያዞረው። ሰውን የሰው አፕሊኬሽን ማረም ናላ ነው የሚያዞረው። በእውነት እኔ አንዳንዴ ይገርመኛል። ግን ምን አገኝበታለሁ ብለሽ ነው ይሄን የምትሰሪው ስላት ትስቃለች። በቃ she just wants to help people እና some people are born like that. of course you are paying ትከፍላላችሁ፣ ግን ቢሆንም ከምትሰጣችሁ ሰርቪስ ጋር ግን የሚነጻጸር የሚመጣጠን እንዳልሆነ እኔ ምስክር ነኝ፣ እርግጠኛ ነኝ። እና we are grateful እግዚአብሔር ይመስገን። እንኳንም እሷ አቫይለብል ሆነች። እኔ አፕላይ ባረኩበት ሰዓት እንደዚህ አይነት እድል አልነበረንም። to be honest with you I wish she was around at that time። እኛ በደመ ነፍስ ነው በቃ ጓደኞቻችን በነገሩን ከኛ በፊት በነገሩን ምናምን በስማ በለው በጭፈን ገብተን እግዚአብሔርም አላሳፈረንም፣ እግዚአብሔር ይመስገን። ግን እናንተ ፎርቹኔት ናችሁ እንደዚህ አይነት ኢንፎርሜሽን ባለበት እኔም ያለፍኩበትን። እሷ ደግሞ ፕሮግራም ዲሬክተርም ሆና ከ25 ዓመት በላይ ያገለገለች ሰው ናት እና በጣም ትጠቅማችኋለች ለማለት ነው። ተጠቀሙበት። እያሰባችሁ ያላችሁ እንዲህ እየተንበዛበዛችሁ ያላችሁ ሰዎች ስለሚጠቅም go ahead, it's okay, it's a couple of $100, it's okay። ሌላ ነገር ላይ ኢንቨስት ከምታደርጉት እዚህ ላይ አድርጉ። it's your future guys, it's your future, it is your future። እና እግዚአብሔር አምላክ ይርዳችሁ። መልካሙን ሁሉ እመኝላችኋለሁ። ኢንተርቪው ያገኛችሁ ሰዎች እንኳን ደስ አላችሁ። ያገኛችኋትን ኢንተርቪው ግን እንዳታበለሻሿት። ዛሬ ያወራነውን ደጋግማችሁ ስሙት። ሳይን አፕ ማድረግ የምትችሉ ሳይን አፕ አድርጉ። ኦልሬዲ ሳይን አፕ ያደረጋችሁ ሞክ ኢንተርቪው ላይ ሲሪየስሊ ተዘጋጅታችሁ ቱ ዘ ቤስት ኦፍ ዩር ካፓሲቲስ ሂዱ። እሷ ጋር ስትሄዱ ጥሩ ፊድባክ እንድታገኙ ማለት ነው። እና ይህንን አድርጉ፣ በርቱ፣ እግዚአብሔር ይርዳችሁ። ይህን ሀሳብ እያሰባችሁ ያላችሁ ሰዎች እንግዲህ እግዚአብሔር መንገዱን ያመቻችላችሁ። ገና ፈተና ላይ ያላችሁ ሰዎች ካላችሁ እግዚአብሔር በፈተናችሁ የሚርዳችሁ። ጉድ ላክ ቱ ዩ። በቃ ከዛ ያው እንግዲህ እጅ ለእጅ ተያይዘን ወደፊት እንሄዳለን። ነገ ጠዋት ደግሞ እኔ ስተወው እናንተ ይህን ተቀብላችሁ ከእናንተ ኋላ ለሚመጣ ሰዎች ደግ ታደርጋላችሁ ብዬ ተስፋ አደርጋለሁ። እግዚአብሔር የሁላችሁንም ሀሳብ ይፈጽም፣ በጎ ሀሳባችሁን። ሰላም ሁኑ። ቴንኪው። እሺ ክቡራን አመሰግናለሁ። በቃ የዚህን የዩቲዩብ የሊንክዲን እና የፌስቡክ ስርጭቴን አቋርጣለሁ። ሶስቱም ላይ አት ዘ ሴም ታይም ላይቭ ነኝ። ትንሽ እዚህ ቆያለሁ፣ ቲክታክ ላይ ቆያለሁ። ያው ቲክታክ ላይ ፎሎ ያላረጋችሁኝ ሰዎች ፎሎ አርጉ። ምንድነው ፎሎ አርጉና ከች በሉ። ቻው፣ ባይ ባይ። መልካም ጊዜ። ስለመጣችሁ ስለተሳተፋችሁ እናመሰግናለን። መልካም ጊዜ። ኦኬ where is that? ትንሽ የማይሆነች ሙዚቃ አለች እኮ የኔ መለያ። ምንም ኤዲት የሚያደርግልኝ የለ ምን የለ፣ እናንተም አታረጉ። አዲሱ ትውልድ ምንድነው አንዳንድ ቪዲዮዬን ምናምን መግቢያ ምናምን ሳውንድ ትራኬን ምናምን ብትቀያየሩልኝ ምን አለ። ቮለንቲር የምታረጉ ሰዎች ቮለንቲር አርጉ። ሐኪሞች፣ የቴክኖሎጂ የምታውቁ ሰዎች